80 million Americans are about to lose their health care. Not because the country's broke, because someone decided billionaires needed a tax cut more than your neighbor needed insulin. The wildest part? The people cheering loudest for these cuts? Most of them are on Medicaid. That's not irony. That's what happens when anger becomes an identity and survival becomes an afterthought. Welcome back to Mind Mirror. Let's get into it.
Lexi Marie, I know. I tell people that all the time, that I am like the brightest ray of sunshine, right? Okay. So you're referring to the video of the woman who's been on here telling everybody why she can't work and why she's worried about losing her Medicaid. You know, the big beautiful bill has her all in a frenzy. She may lose her Medicaid because she doesn't want to work. And we do know the full story because she puts it out there on TikTok continuously. We know the full story. And it's literally just excuse after excuse after excuse after excuse of why she can't work. Doesn't want to work like the rest of us who work and pay taxes. So people like her can just continue to collect and collect and collect and not contribute like the rest of us. So we absolutely know the full story. It's not really judging, just kind of spitting facts out there of why people like that are the reason why the big beautiful bill is in place and cuts to Medicaid are coming.
Classic move. Find the one person who seems lazy, zoom in hard, and use her as the face of 80 million people. That's not analysis. That's a magic trick. Keep the audience angry at the bottom so they never look up at who's actually picking their pockets. And here's what she doesn't realize. The same big beautiful bill she's defending, it doesn't send her a refund, not a dollar. The savings don't come back to working people. They get absorbed into tax cuts for people who haven't checked their own bank balance since 2019 because the number stopped being meaningful. But sure, focus on the TikTok lady.
If you won't work 20 hours and you are able-bodied, keyword here, able-bodied, which the woman in that is very much so able-bodied.
Why do you guys keep acting like the continuing resolution isn't funding Medicare and Medicaid at the exact same levels? Like Jeremiah here says, is it wrong the Democrats are asking the government to fund Medicare and Medicaid? Come on record and say you don't want that. Jeremiah, you understand that's not what the Democrats are asking for. That's not what they're shutting down the government over. No, because the continuing resolution funds Medicare and Medicaid at the exact same levels it's been over the last few years. What the Democrats are demanding is an additional $1.5 trillion. They want to take 25% of our entire federal budget and add it on top of our debt.
Strip the context, drop the scary number, walk away. That's the whole playbook. $1.5 trillion. Sounds insane until you realize that number isn't a wish list, it's a consequence calculator. It represents what happens when 10 million people lose insurance and flood emergency rooms with no way to pay. Uncompensated ER care doesn't disappear. It gets spread across everyone else's hospital bills, insurance premiums, and tax dollars. Cutting Medicaid doesn't eliminate the cost, it just moves it somewhere harder to see and easier to ignore. Nuance doesn't fit on a bumper sticker though, so here we are.
Lock in, fuck niggas. We about to fact check this shit. First, if you fuck with me, check out that podcast. Let's get it. What the hell are you talking about? I will try to explain the government shutdown to you so you have a better understanding of what the hell is going on. You see, what we need to understand is that the One Big Beautiful Bill does two things to healthcare. First, the One Big Beautiful Bill changes the qualifications to receive Medicaid and food stamps. One example is work requirements for SNAP benefits is now 64. It used to be 54. Meaning people over the age of 60 will now have to get back to work, which is pretty difficult for some, which is why it's reported that within 10 years, 10.5 million people will lose their healthcare insurance, which will amount to $1 trillion. Hence, the $1 trillion being lost in Medicaid. The second problem is that the One Big Beautiful Bill limits the provider tax, which is how the states provide for their state-funded programs. And the government matches that for the federal-funded programs. So programs that focus on healthcare is losing money. So the $1 trillion that Democrats are asking for can be negotiated, meaning that these programs can be funded within 10 years, and that money can be used for the individuals that lost their health care. Not to mention that the continuing resolution bill could have extended the Obamacare tax credit. I mean, they extended a whole bunch of other programs. So in all, almost 30 million people will lose their health care coverage because of Trump and their MAGA Republicans.
30 million people. That's the entire population of Texas. Gone from the insurance rolls overnight. And the talking point is always able-bodied work requirements, like the majority of Medicaid users are watching Netflix all day. Reality check. 60% of working-age Medicaid adults already have jobs. Waitresses, warehouse workers, home health aides. Jobs that just don't come with a benefits package. The other 40%? Caregivers, students, people managing conditions that aren't visible on a TikTok clip. When you build policy around the worst-case anecdote instead of actual data, this is what you get. 30 million people learning the hard way that vibes aren't healthcare.
Good morning. MAGA, I don't have much today. Just a question. Question I want to ask you. Well, really a question I want you to ask yourself. If you would just humor me. Close your eyes. Think about it. Don't respond. Just think about it. What is your first thought when you hear that someone wants to increase the budget, the funding for the U.S. military? What's your first thought? It's patriotic, right? It's great for the United States of America. That's the thought. Now, what's your first thought when you hear that someone wants to increase the budget or funding for healthcare or education in our country? It's socialism, right? That's your thought. Now, you didn't come up with that on your own. No. That being your first thought on both of those things, that's by design. That's called indoctrination. Now, let me ask you the second question. What could make America greater than a healthy, skilled, and educated populace of people? What could make us competitive with the rest of the world in the short and the long run? Anyway, God bless America. And I hope that everyone has an excellent day.
Military spending, patriotic, healthcare spending, socialism. Sit with that for a second, because nobody's born with that reflex. It gets installed carefully over decades by people who benefit enormously from you never questioning it. A healthy, educated, skilled population is the single most competitive asset a country can build. Germany knows it. Japan knows it. South Korea knows it. Every nation consistently outpacing the US in productivity figured this out generations ago. We're still arguing about whether sick people deserve a doctor. That's not a values debate. That's the result of very deliberate, very well-funded messaging, and it's working exactly as intended.
If you're celebrating the cuts to Medicaid, Obamacare, and SNAP because I don't want my tax dollars going to somebody who doesn't need it or deserve it, you do realize that you're not getting a refund. There's no money coming back to you for this supposed savings. Instead, they're basically taking your tax dollars and they'll move it to another government program, which you also probably don't like. Or even worse, they're giving it to billionaires. They're giving it to people like Jeff Bezos. And if you're happier about your tax dollars going to Jeff Bezos instead of somebody who might need health insurance, that's really fucked up.
No refund, no check, no congratulations on the savings. Cutting these programs doesn't return money to working people. It gets reshuffled into tax relief for people whose accountants handle numbers most of us will never see in a lifetime. So the person celebrating these cuts isn't getting anything back. They're just making sure someone else gets less. That's not fiscal conservatism. That's not even logical self-interest. That's pure spite dressed up as policy.
Hello. I definitely wanted to reply to this as a nurse, and he is 100% right. I do home health nursing, so I am frequently seeing people in facilities, long-term care facilities, adult foster care homes that are people that are bedbound and are on Medicaid, and their room and board are paid for by Medicaid. So if they cut their Medicaid and they have nowhere to go and they're completely bedbound, you couldn't just put them on the street legally. Like you couldn't just shove these people in the street. They can't get out of bed. You know, a lot of them have catheters and, you know, other things as well. So the only thing that a long-term care facility, adult foster care home, assisted living facility could do is send them to the hospital. So basically, once they cut all of these people's housing funds that are medically fragile, our hospitals are going to get flooded, which will bankrupt them. It will absolutely bankrupt the hospitals in our country. It will. And nobody will be able to get in to get a bed that needs emergency care. It's crazy. And that they haven't thought of this is bananas.
I always think it's kind of interesting when I walk into a patient's room. I'm an occupational therapist in a hospital, and Fox News is playing. And then I'm looking through their chart to see what their insurance is, because I'm hoping to order them a walker or shower chair or whatever, and need to know if it's covered or if I need to tell them they need to purchase it themselves. And then I see Medicaid, 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 Medicaid. And then the patient also isn't working. So I'm like, well, you're probably getting some sort of benefits to survive. And I just, like, it doesn't make sense to me. Like, how can you support this person, this orange man, but none of y'all have private health insurance? Make it make sense. Can someone make it make sense? Like, do you realize what's about to happen? Do you realize the cuts to Medicaid and how it's going to affect y'all? Like, did anyone read Project 25? I don't think so. It's like people just vote for this man, and I don't understand it. I don't think they know. I just don't get it. Please, someone make it make sense.
She's asking the right question, and honestly, the answer is uncomfortable for everyone. It's not stupidity. People aren't broken. What's happening is that identity and belonging have been weaponized so effectively that they now override material self-interest. When your entire social world, your church, your family, your town is unified around a political identity, voting against it feels like betrayal, even when the policy is literally removing your healthcare. The threat of social exile is more immediate and more visceral than a policy change that takes years to fully land. That's not a bug in the system. For the people writing these bills, that is the system. Keep the tribe loyal, keep the anger pointed sideways, and the math never has to make sense.
Remember last week when we talked about Florida cutting HIV medication access for over 15,000 people? Well, looks like that was just the beginning. Last week, the Trump administration cut $600 million in public health funding from California, Colorado, Illinois, and Minnesota. The reason? These grants do not reflect agency priorities. Let me show you what this actually means and why it affects all of us. Here's what's being cut. Public health infrastructure grants, the money that funds outbreak response, workforce, data systems, and emergency preparedness. 24 grants specifically for HIV and STI prevention, $5.2 million from Lurie Children's Hospital for HIV prevention among Black women, and over $1 million from the American Academy of Pediatrics for training pediatricians. These aren't fringe programs. This is the backbone of public health. So, what are these priorities? In September, the CDC said they're moving away from programs focused on diseases that predominantly affect certain populations because health equity work has undermined core American values. Translation, programs serving Black, Latinx, and LGBTQ communities are being systematically defunded, and they're calling it merit. This is how Florida happens. Federal cuts create state budget crises, states cut safety net programs, and communities absorb the consequences. It's not isolated. That's the plan. So, why should we care? These cuts are happening during active measles outbreaks. They're eliminating the workforce that responds to disease spread. Without modern data systems, we can't track outbreaks. Without HIV prevention programs, we get more new infections, which cost millions in lifetime treatment. You know what's cheaper? Prevention. When you gut public health infrastructure, individual providers can't fill the gap. People fall through the cracks, preventable diseases go undiagnosed, outbreaks spread, and by the time patients reach the ER, we're managing crises that never had to happen. Disease doesn't respect state borders. When California loses outbreak response capacity, that affects everybody. A federal judge already ruled HHS as a retaliatory motive, cutting grants to the American Academy of Pediatrics after they opposed administrative policies. This is weaponizing public health funding to punish political opposition. All right, Ariel, so what can we do about it? California, Colorado, Illinois, and Minnesota are suing. Support those legal challenges. Also, contact your U.S. senators and representatives. Congress already appropriated this money. Demand they protect it. Support your local health departments and community health centers absorbing these cuts. And call it what it is. Punishment for states that disagree with the administration on immigration and health equity. Don't let anyone sanitize it. Disease doesn't care about your politics. When you dismantle the infrastructure that keeps us safe, everyone pays the price. In longer ER wait times, preventable deaths, and epidemics we had the tools to stop. COVID-19, anyone? But we don't have to accept this. We can fight back. Check the caption for lawsuit updates, legislative contacts, and how to support local public health. This is Med Monday, and we're just getting started.
With the terrible vote last night in the U.S. Congress, it seems clear that Republicans in D.C. want to cut Medicaid to pay for tax cuts for the richest Americans. And Minnesota, I need you to know how massive Medicaid is in your everyday life and in the health of our state. Medicaid is the single biggest source of health care in our state, period, end of sentence. And most of that health insurance goes to the most vulnerable among us. 3 out of every 10 births are covered by Medicaid. And when you expand out to other communities, the indigenous community, it's 8 out of 10 births. In the Black community, it is 9 out of 10 births. Even after they're born, Medicaid covers an incredible amount of our children, the youngest Minnesotans we have. Medicaid covers 41% of all children across the entire state of Minnesota. Many of the healthcare crises we are in right now, Medicaid picks up the slack. You want to talk about mental health resources? Medicaid across the state covers 20%, 1 out of every 5 mental health coverages. That makes it the #1 provider of mental health services, insurance in the state. If you want to talk about substance use disorders, which again, I think most people would say is at a crisis point because of opioids and other things that have happened in the recent past, Medicaid covers half of our substance use disorder treatments in the state. Cutting these services will hurt all of Minnesota.
41% of all children in Minnesota, 9 out of 10 births in the Black community, half of all substance use disorder treatments statewide. That's not a fringe program. That's the circulatory system of an entire state's healthcare infrastructure. And here's what people keep missing. When Medicaid gets cut, rural hospitals are the first to feel it. Small-town, conservative voting communities are disproportionately dependent on Medicaid reimbursements to keep their local hospitals alive. When those reimbursements disappear, the hospital closes. Not the one in a major city with 6 alternatives nearby. Your hospital, the one 40 minutes down the road already running on empty. The cut doesn't stay where they point. It spreads.
It'll hurt you, even if you're not on Medicaid, because that means Medicaid dollars are not going to be going to hospitals and private practices and community cares and dentist's office, so they might have to lay off staff. It's going to hurt you if you're going to start a family. It's going to make children less healthy, go to school, get other kids healthy. I mean, across the board. This is cruel, and remember, it is all in service of the rich getting richer and not having to pay taxes. That's why they're making this choice to cut Medicaid. This is the MAGA agenda.
Now, I will admit this. I am 57 years old, and I've been on this earth for a long time. I heard something. I was today years old when I heard this, and it floored me. It stopped me in my tracks. There was a creator, and I'm going to tag him below, that made a statement that just blew my mind. He said, and I believe it's probably more, that during the American Civil War, 90% of the Confederacy, the people who died in the Confederacy, did not have enough money to own slaves. They were willing to die to keep Black people down or enslaved. They neither owned slaves or owned land. This is exactly what we are experiencing today. I said yesterday that over 500,000 white people in the state of Louisiana will lose their Medicaid. And I'm willing to bet that 90% or more of those specific white people voted for Donald Trump, voted for Steve Scalise, voted for Mike Johnson, and voted for all the other Republicans who are willing and desirous of taking the benefits, the resources that they need to survive and to live away. Makes no sense. That is MAGA.
90% of Confederate soldiers didn't own slaves. They died protecting a system that economically crushed them while making plantation owners rich. He's not wrong, and that parallel hits harder than most people want to admit. Right now, hundreds of thousands of people are preparing to lose Medicaid coverage in states that voted overwhelmingly for the politicians cutting it, and next election, a significant portion will do it again. Not because they're uninformed, but because the enemy has been defined so completely, immigrants, elites, the woke, that the person literally removing their healthcare still registers as their protector. That's not a political failure. That's a cultural architecture built brick by brick over decades, and it's extraordinarily hard to dismantle from the outside.
Good morning, everybody. Just when you think Republicans couldn't fuck shit up anymore, they decide in their committee meeting last night at 1 a.m., mind you, that they're going to potentially add in $500 billion worth of Medicare cuts to this new budget bill. That's on top of them cutting Medicaid, SNAP benefits, and other things. I want to know what fucking alternate reality these people are living in. Republican representative from Missouri, Jason Smith, said this. He said, and I quote, "Americans voted for an America where workers and families will thrive again. Main Street and rural towns will grow again. And America wins again." Whose America are you talking about there, bud? Because it sure as hell isn't the people in your state when you cut their Medicare and Medicaid benefits. It sure as hell isn't the people in my state. So who are you talking about? God forbid Republicans increase taxes on billionaires. God forbid. Because they wouldn't have to cut Medicaid and Medicare if they just made billionaires pay the taxes that they actually owed or made them pay a fair share of taxes. It's like they somehow think that if they raise taxes on billionaires and super wealthy, that they're somehow going to end up destitute within like 5 months. Obviously, that's not going to happen. Elon Musk is not going to be eating beans and weenies anytime soon because he runs out of fucking money from paying extra taxes. Jeff Bezos is not going to be on a street corner begging with a fucking cup in his hand because he can't bring in enough money from Amazon and all his stock options. It's just not fucking logical. But you know what it is? It's the fact that those billionaires donate more money to campaigns like this dipshit from Missouri and to people like Mike Johnson and Marjorie Taylor Greene and Lauren Boebert and all those fucking pieces of trash in Congress. On both sides, actually. They're the reason that people in my family may lose their Medicaid. They're the reason that people that come to my clinic and only have Medicaid or that rely on SNAP benefits to feed their kids may not be able to afford health care or feed their children properly. They're the reason. You are all cowards. You are all trash because you know this is wrong. You know it, and you're still doing it. Because you're too afraid of Donald Trump and you're too afraid that your political career might suffer. So you'd rather ruin the lives of literally millions of people. Literally millions of people. Because you know the bottom 10% of this country is going to suffer the most. Whereas the top 10% are going to benefit the most. You're all fucking trash. Every single Republican in that Congress is garbage in my book. And the Democrats, they're not fucking far behind them. They haven't done anything.
And he stuck the landing with the most honest line of the whole video. Because this isn't just one party's problem. This is a system that serves capital over people. And both parties have had their hands in building it. The difference right now is scale and direction. One side is actively, openly cutting healthcare for tens of millions to fund tax relief for the wealthiest. That's not spin. That's the text of the actual bill. But if the only answer is just vote, you're still playing inside a system that got us here. Real pressure means demanding more, from everyone, at every level, not just every 4 years. Here's the bottom line. The people hit hardest by these cuts aren't abstractions. They're the nurse doing home visits at dawn, the rural hospital running on Medicaid reimbursements, the 60-year-old told to get back to work or lose coverage. And the cruelest part isn't the policy. It's that millions of those exact people believe the system taking from them is fighting for them. Economics doesn't negotiate with belief. Hospitals don't stay open on loyalty. The bill arrives eventually for everyone. The question is whether people realize that before or after they've lost everything. Drop your thoughts below and subscribe if this one hit different. See you in the next one.